Can the brain be changed as a result of getting COVID infections? That is a question many people have because, yes, there are those that get COVID, they have it for 2 to 3 weeks. Maybe it's only a couple of days they feel, and then they move on with life like normal. But then there are those that tend to get long COVID, brain fog, fatigue, dizziness, memory issues, depression, anxiety, and so much more. What we are going to do is look at some of the research and help you better understand what is happening. Because initially, when everyone was talking about COVID, it was all about respiratory issues, right? People were getting put on ventilators. So it's like, oh, it's got to be our lungs. But with those dealing with long COVID, that's really not the case for the majority of people. And that's why looking at the brain and understanding that is super critical. Here, this is a recent article that came out December 11th, 2023. MRI reveals lasting brain changes in post-COVID patients. Now, before we even go into this, I need you to understand that MRIs, now this is not your normal MRI, this is a more in-depth one that looks at it differently, shows lasting brain changes. Question I want you to ask yourself is, who has evaluated the health of your brain since getting COVID? Anyone. Who is evaluating your brain health? Right? Is your primary care doing it? Is your physical therapist, whoever you're seeing, are they evaluating your brain health? And for most of you, I already know the answer. It is no. No one's evaluating your brain health. How do I know that? Because I get a lot of people who come in to my office who are dealing with issues from COVID, and no one's looked at their brain health either. And even if they ask them about some of the brain symptoms, no one does anything. So we're going to talk about what you can do as well. Now, what they did, they used what's called diffusion tensor imaging. Okay. This is a way to look at tracks differently than you can do with a regular MRI. So you can get it, especially if you're in bigger cities. Now, what did they see? This shows changes in white matter structure between COVID patients with long-term symptoms and healthy individuals. Okay. So your brain, ultimately, the pathways get thrown off. So when you deal with fatigue from COVID and brain fog, don't forget that it can actually be the result of what COVID does to the brain. So we're going to explain that a little bit more. Now we're going to look at this. So brain injury in COVID-19 is associated with dysregulated innate and adaptive immune responses. Once again, just look at those first few words. Brain injury. Yes, you can absolutely sustain a brain injury from COVID. You do not have to hit your head to get a brain injury. Okay. If you do hit your head, that's called a traumatic brain injury. If you don't hit your head and you get an infection that induces a brain injury, it's just a regular brain injury. Now, what they say here is these results demonstrate that brain injury is a common consequence of both COVID-19 and influenza, so the flu. This is something I tell my patients all the time is they're like, I feel like I have a concussion, but I never hit my head. I'm like, I know, I call it a COVID concussion, right? You get a concussion from the infection. So once again, is your brain being looked at? Now, there were some of these markers that they were looking at as well, neurofilament light. So neurofilament light, this is a marker that can be done through some of the regular labs. Little fibrillary acidic protein. You may be able to get it. I'm not exactly sure where to get that from the beginning. Some of these are more research based, but neurofilament light chain is getting to more commercial markets at this point in time. But these are things to really look at what's happening within the brain. So yes, COVID is a brain injury. Next, neural dysregulation and post-COVID fatigue. This is probably one of those things that drives people nuts the most. It's their fatigue following COVID when they just get into this long COVID phase. And it just impacts them for a really, really long time. So ultimately, once again, they're looking at neural circuitry that ultimately gets thrown off. Specifically, So they're seeing underactivity in different circuits, dysregulation of your autonomic nervous system. So most people know this as your fight or flight. And then even changes in skeletal muscle. Now, when you look at all of these together as a whole, you need to address them. You don't say, oh, well, let's pick my favorite and not do the others. So at this point in time, I think it's abundantly clear that this causes issues with the brain and causes a brain injury. Now, people are like, well, but what about my fatigue? Like, are you sure it couldn't be my thyroid? Are you sure it couldn't be my hormones? Well, I mean, always get those checked, right? That's a good idea. But did you know your brain, when it's healthy, uses 25 to 30% of the entire body's energy? There's no other organ that uses as much as your brain does. So if the brain's inefficient because the circuitry's off, then expect to have fatigue. So when we look at the brain, we need to say, one, how is it connecting, right? So in that one study, they did a fusion tensor imaging, which can help, but you can do it without doing super expensive testing. You evaluate it very much like you would a concussion. Eye movements, balance, and cognition. Look at those. Those are routinely off in a lot of patients dealing with long COVID. When you have that information, you can then get a rehab strategy to fix it. Next, your mitochondria don't produce energy as well as they should. Your mitochondria is in cells throughout the body. So if that's not happening and your brain uses more energy than any other part of the body, normally as the day goes on, you will feel worse and worse and worse. Maybe it's word finding, brain fog, mood, dizziness, and other things like that. And then lastly, as we talked about, there are immune changes following COVID. So it's not so much that there's this infection that you still need to kill a year later. It's more of like a hurricane or a tornado that goes through. Okay, that is gone. But there's the aftermath where you have to create a good environment for repairing tissue, quieting down the inflammatory response that's still persisting. Part of that, right, can be done with labs, but don't be shocked if your labs are normal. They often are. But you start with saying, okay, where's your nutrition, right? Is your nutrition promoting good health, good veggies, nuts and seeds, good oils, avocado oil, olive oil, good fats and proteins, wild caught fish, grass-fed beef, other things like that. Now, after that, you can work with someone and get targeted nutritional supplements. I know a lot of you are like, but tell me which one to take. There are so many that could have potential benefits in my experience, but it needs to be individualized for you. If it's not individualized, you are likely going to have this big trial and error, may succeed some, may waste a lot of money on others. Hope you found this framework really beneficial with understanding the brain changes that happen after COVID infection, what the symptoms are, as well as how to get this evaluated and a framework to start moving forward with to finally get your life back after that infection. Until next time, this is Dr. Z, the Brain Guy.